February is American Heart Month, and it's a time to raise awareness about the growing worldwide problem of heart disease and stroke. And today we're going to learn a little bit about the advances in cardiac care and how they can increase your odds for living a better and longer life. Joining us now is Dr. Robert Golub, and he's a cardiologist at Mid-State Medical Center. Thank you for joining us.
Good morning, Ryan.
All right, now, Doc, tell us a little bit about why there is such a big problem now with heart disease.
Well, the risk factors are still with us, and obviously people are getting older, they're living longer. A lot of people have a problem with being overweight. We have all the usual risk factors: hypertension, diabetes, smoking cigarettes, and so on. And so we're seeing more heart disease.
And I was reading that it's now the leading cause of death in the United States.
In the United States and all the developing countries now. It's also catching up. It used to be that infectious diseases were bad in the developing countries, but heart disease has taken #1.
Wow. That's kind of scary when you think about it. Do you have any recommendations as to how we can kind of decrease it? Is it just based on our diet and exercise?
Right.
Or?
I think that we often think about heart disease as very complicated, high technology, fancy procedures in hospitals. My advice is to stick with the basics. The basics work really, really well. If nothing else, go out and lose 10 pounds if you're a little overweight. Working on the basics: high blood pressure, blood sugar, cholesterol, don't smoke cigarettes, get some exercise. And I think a really important piece of advice is small steps matter a huge amount. You don't need to be perfect. You really don't. Taking a small step, losing 10 pounds, even if you're 50 pounds overweight, is a great thing.
Yeah, and because that's really a big factor. If somebody has a heart attack, it's better to prevent that than having to go through a heart attack, because that'll really wake you up, and you don't want to get to that point.
Our goal in everything we're doing is to prevent more events, to prevent problems before they happen. That is our #1 goal.
And you're doing that now with echocardiograms. Can you tell us a little bit about what an echo is and how it's helping with the new technology?
The echocardiogram is a great connection between the fancy high technology things and the back to basics low technology things. It's an ultrasound, so there's no side effects, no danger, no radiation. It's very easy to do. It's done by a technologist in the office, and it's done, you take little pictures using an ultrasound probe between the ribs, and you get beautiful pictures of the heart, giving you lots of information, and it's very easy for the patient.
All right, well, let's take a look at some of them. I'm going to have you go through and kind of explain what's actually going on here.
This first echocardiogram is a normal picture. This person has a completely normal heart. The pumping chamber of the heart is on the left side, and you can see it moving in and out, and it's squeezing and pushing blood out to the body. So you can do a formula to this and come up with the squeeze of blood or ejection fraction, and this person has a normal heart.
Okay, let's move on to the second one, which is not as good as the first one, right?
The second picture is someone, a different human being, a patient who has severe classic heart failure. In this case, the pumping chamber is not moving the way it was in the previous picture. You can see that it's just not squeezing that blood. There's not much motion, and so this person has heart failure.
And that's towards the bottom of the screen there. You can see that, right?
You can see it on the bottom. You can see it on the left side. That left-sided chamber is not moving very much blood. We want it to be coming in and out, pumping like this. Instead, what it's doing is sort of staying like this. So very little blood is moving forward.
All right, and we have another one for you. Here's #3. Tell us a little bit about
this. Again, another view of the normal heart. This is the same patient as 2 shots ago. Normal heart, 4 chambers. We all learned it in school. This person is doing fine.
Okay, and then the fourth one here. This is severe in this case.
This person has severe heart failure. Their heart is enlarged. They've got a lot of problems. Now, nowadays, compared with 20 years ago, the treatments for advanced heart failure are much better than they used to be. We have much better treatments. Those people end up going back and forth between the office and someplace like the Advanced Heart Failure Center in Hartford, but much better treatments than years ago.
Okay, and then now we have the final one, which is the T.
This is a close-up. Rarely, less than 5% of our cases need a procedure where we put a tube into the stomach. Patient's completely asleep, no discomfort. The patient does not know what's happening. And this is a close-up view from the stomach of a heart valve. This is, you can see on the left, bulging of this valve upwards. It's bulging in an upward direction. And that's called mitral valve prolapse. That's a severe case of mitral valve prolapse.
Okay, and then we have one more here where the blood is flowing backwards.
In this
the
one,
heart.
it's the same picture, but this time we can see the blood, and we can actually see the blood going in the wrong direction. This person has severe mitral valve prolapse with leaking of the valve, and this person needs surgery.
Okay, all right, and that's the last of all the videos and photos there, but say somebody has some of these problems. What are some of the steps that you and your team would take?
Well, let's take this case. This patient is someone I know for many years. I know her family. She had this procedure done at Midstate. She was under a little bit of anesthesia. While she was waking up, 3 minutes later, we have a very fancy computer system that goes to Hartford Hospital. The chief cardiac surgeon at Hartford Hospital and I were on the phone discussing this case 3 minutes after the procedure was done. He was in Hartford, I was at Midstate. 5 minutes afterwards, we had a plan. 10 minutes after.
5 minutes you had a plan for the
We
whole
had a plan
procedure.
for this case in 5 minutes.
Wow.
We had and then the patient woke up from her light anesthesia, and 10 minutes later, with her husband, we were having a conversation about a plan of what was wrong, how severe it was, what was going to be done, how we needed to fix it, and when we needed to fix it. So the fancy sort of using the internet computer system makes a huge difference in delivering this high technology stuff to people everywhere.
All right, doctor, thank you so much. It's great to see that technology is helping you to do your job better and more efficiently, and of course helping all of your patients. And if you would like more information, of course, head on over and see Doc and get an echocardiogram. It's good to be preventative, and head on over to midstatemedical.org for more information. And now we're going to